Hello friends, welcome to our YouTube channel Nursing Solution. So today we are going to discuss about MCQs on communicable diseases. जैसे कि हम सब जानते हैं कि कम्युनिकेबल डिजीजेस जो हैं वो एक इम्पॉर्टेंट पार्ट है नर्सिंग कॉम्पिटिटिव एग्जाम्स का, बेसिकली कम्युनिटी हेल्थ ऑफिसर एंड पब्लिक हेल्थ नर्सेस के लिए. सो इन दिस कम्युनिकेबल डिजीजेस पार्ट 1 इसमें पूरे 20 क्वेश्चंस हैं जिनको हम वन बाय वन डिस्कस करेंगे. सो जो हमारा फर्स्ट क्वेश्चन है वो है एनलार्जमेंट एंड टेंडरनेस ऑफ पैरोटिड ग्लैंड, जिसे कि हम पैरोटाइटिस भी कहते हैं, इज सीन इन विच कंडीशन. So we all know that parotid gland it is a salivary gland. So basically in a human body there are 3 salivary glands and parotid gland is one of the largest one, whereas जो इसके अलावा 2 और हैं वो है हमारे पास sublingual salivary gland and submandibular salivary gland. So इस क्वेश्चन के लिए जो हमारे पास 4 ऑप्शंस हैं वो क्या क्या है. फर्स्ट ऑप्शन है मीजल्स, सेकंड है मम्स, थर्ड वन है रुबेला एंड फोर्थ है इन्फ्लुएंजा. सो इसका करेक्ट आंसर क्या है? इसका जो करेक्ट आंसर है वो है मम्स. सो मम्स क्या है? इट इज अ काइंड ऑफ अ रेस्पिरेटरी डिसऑर्डर जो कि अंडर 5 चिल्ड्रन को सबसे ज्यादा अफेक्ट करता है एंड इट इज कॉज बाय वायरस नेम मिक्सो वायरस. और जो हमारे पास मीजल्स है, मीजल्स भी एक रेस्पिरेटरी डिसऑर्डर है, अंडर 5 चिल्ड्रन को अफेक्ट करता है एंड इट इज ऑल्सो अ वायरल इन्फेक्शन दैट इज कॉज बाय पैरामिक्सो वायरस. एंड मीजल्स का अदर नेम क्या है? इट इज ऑल्सो नोन एज रुबेला, whereas rubella is also known as German measles. So in this picture we can see कि हमारे 3 सैलिवरी ग्लैंड्स होते हैं, जिनमें से पैरोटिड ग्लैंड जो होता है वो सबसे बड़ा होता है एंड इट इज इन फ्रंट ऑफ द ईयर. एंड इस पिक्चर में आप देख सकते हो कि एक पिक्चर में देयर इज अ नॉर्मल पैरोटिड ग्लैंड विदाउट द स्वेलिंग, विदाउट एनी एनलार्जमेंट एंड टेंडरनेस. और जो सेकंड साइड है वहां पे इस बच्चे को क्या है, मम्स हो रखा है, जिसमें क्या है कि वी कैन सी कि द चाइल्ड इज हैविंग स्वोलन पैरोटिड ग्लैंड. तो इसकी वजह से क्या हो सकता है कि चाइल्ड जो होगा उसको फीवर हो सकता है, द चाइल्ड मे हैव ईयर एक, उसके कान में दर्द रहेगा and there can be the stiffness of the mouth. So the next question is Koplik spot is associated with the diagnosis of which of the following disease, and the options are chickenpox, mumps, rubella and measles. So Koplik spot जो है it is a clinical sign of measles. So in this picture you can see कि these are the Koplik spot that you can see inside the buccal cavity near the cheek of the child, and with this we can rule out that the child is suffering from measles. Now the third जो question है वो क्या है कि the 3 C's concerned to measles are, and the options are cough, cyanosis, choking. The second option is cough, coryza, conjunctivitis, and the third option is cough, coryza, choking. Fourth is cough, cyanosis, and conjunctivitis. So for this question, the right answer is cough, coryza, and conjunctivitis. That is option B. So the child who is suffering from measles will show the symptoms of cough. As I have already told you that measles is a respiratory infection that basically affect the children who are less than 5 years of age. Then the child will show the symptom of coryza and conjunctivitis. Conjunctivitis is one of the complications that you can see in the children who are suffering from measles. And apart from measles, there is also one disease in which you can see 3 C's. और वो कौन सी disease है? That is known as TEF, which is you can see in pediatric, which is known as transesophageal fistula. In what is transesophageal fistula? That it is the abnormal connection between the two tubes, that is trachea and the esophagus. So there will be the fistula will be present between the esophagus and the ट्रेकिया, ड्यू टू विच जो बच्चा होगा उसको क्या होगा कि जो उसका the child can aspirate the swallowed liquid or food in the lungs. तो उसकी वजह से बच्चा क्या सिम्टम शो कर सकता है? तो चाइल्ड कैन शो द सिम्टम ऑफ कफ, साइनोसिस एंड चोकिंग. So the option one are the clinical symptom of transesophageal fistula, whereas option 2, that is cough, coryza and conjunctivitis, are the symptom of measles. Now the third one is incubation period of measles is 7 days, 10 days, 14 days and 45 days. So the first question is, what is incubation period? So incubation period क्या होता है? So incubation period, it is a period with from the contact of the microorganism till the first symptom appear. मतलब जब पर्सन की बॉडी में माइक्रो ऑर्गेनिज्म गया और जब तक उसको फर्स्ट सिम्टम शो नहीं होता, उस पीरियड को हम क्या बोलते हैं? उस पीरियड को हम इंक्यूबेशन पीरियड बोलते हैं. एंड हर एक डिजीज कंडीशन का इंक्यूबेशन पीरियड अलग अलग होता है. तो अगर हम मीजल्स की बात करते हैं तो इन दिस केस ऑप्शन बी, दैट इज 10 days इज करेक्ट, बिकॉज द इंक्यूबेशन पीरियड till the fever appear is 10 days and the incubation period till the rash appear is 14 days. तो जब तक बच्चे को फीवर शो होगा मीजल्स में, हम अगर वो वाला इंक्यूबेशन पीरियड देखें तो उसमें that will be 10 days and till the rash appear that will be 14 days. So after contracting the microorganism, after 14 days the child may show the rash on the body. Now the next question is, which is the first sign of chickenpox in children? So again, chickenpox is again a respiratory infection. Again, it is common in under 5 children. And the first and the options for this question are fever, rashes, shivering, and malaise. So the correct answer is rashes. So in case of chickenpox, the first symptom that appear will be the rash, and that is on the trunk. The first rash will be shown on the trunk, then it will shown on the other part of the body. Now the next question is, AIDS was first detected in India in the year. Options are 1985, option B 1986, option C 1987 and option D 1991. So we all know that AIDS stands for acquired immunodeficiency syndrome, and in India the first case was found in Chennai in the year of 1986. So the correct answer for this question is 1986. And in 1991 the government of India started the program, that is National AIDS Control Program. Now the next question is, in HIV, window period indicates a time period between, and the options are, the first option is infection and onset of the first symptom, infection and detection of antibodies against HIV, infection and maximum multiplication of organism, or option C, none of the above. So HIV is the causative organism of AIDS, and HIV stands for human immunodeficiency virus. So in this question, the right answer will be the option B, that is infection and detection of antibodies against HIV. So once the patient get the infection until the antibodies are found in the blood of the patient, that time period is known as window period. Whereas the option A is the definition of incubation period, infection and the onset of the first symptom. Now the question 8th is, confirmatory test of HIV AIDS is, first option is ELISA, second is Western blot test, C1 CD4 count, and fourth option is VDRL. So in this case, the right answer is Western blot test. Western blot test is the confirmatory test of HIV AIDS. Whereas if the question came like which is the screening test of HIV, तो उसमें हमारा सही आंसर क्या होगा? In that case, the right answer will be ELISA test, that is known as enzyme linked immunosorbent assay. Whereas जो हमारा VDRL है, VDRL जो है that is related to sexually transmitted diseases, और जो CD4 count cell है, CD4 count cell is the important indicator for the stage of एड्स कि वेदर द वायरल लोड इज डिक्रीजिंग, वेदर द जो पेशेंट की एआरटी थेरेपी है वो इफेक्टिव है कि नहीं है, तो उस केस में जो CD4 काउंट है वो हम देखते हैं. सो द 9th क्वेश्चन इज which of the following is an indicator of AIDS? So the options are, if the CD4 count is less than 200 cell per mmq. Option B is if the CD4 count is less than 400. C, if the CD4 count is less than 600 cells per mmq. And option D is CD4 count less than 800 cell per mmq. So in this case, the right answer will be option A, that is CD4 count. If lower than 200 cell per mmq, then we say that the patient is having AIDS. Now the next question is, the most common AIDS related neoplasm is. So which is the most common cancer that is related to AIDS? So the options are non-Hodgkin lymphoma. This option B is cervical cancer. Option C is Kaposi sarcoma, and option D is Hodgkin lymphoma. So as in AIDS, the immunity gets suppressed and the patient is at a higher risk of getting opportunistic infection. मतलब कि पेशेंट की जो क्षमता होती है किसी भी इन्फेक्शन से लड़ने की वो बहुत ही ज्यादा कम हो जाती है, जिसकी वजह से पेशेंट को और भी ज्यादा प्रॉब्लम्स हो सकती है, और भी ज्यादा डिजीजेस हो सकती है, जिनमें से कि कॉमनेस्ट क्या क्या है, लाइक कि पेशेंट को ट्यूबरक्लोसिस हो सकता है, साइटोमेगालो इन्फेक्शन हो सकती है. तो उसी में से एक जो सबसे कॉमनेस्ट न्यूप्लाज्म है वो क्या है? ऑप्शन सी, कापोसी सार्कोमा. सो द पर्सन जिसको HIV एड्स है एंड द पर्सन के जो CD4 काउंट सेल्स हैं वो बहुत ज्यादा कम है, तो इन दैट केस द पेशेंट मे हैव कापोसी सार्कोमा. Now the next question is, strawberry spot cervix is seen in which condition? So the options are Candida albicans, option B Trichomonas vaginalis, option C cytomegalovirus, and option D herpes. So in the options, it is clear that this symptom is related to sexually transmitted infections because all the four options are related to STI. So the disease in which the strawberry spot cervix is a clinical symptom, that is Trichomonas vaginalis. Option B is the correct option for this question. So here you can see the person, the female is having the cervix in on which there is red spots are present, just like strawberry. So that's why it is known as strawberry cervix. Now the question number 12 is, pea soup diarrhea is a feature of which disease? So the options are rotavirus diarrhea, cholera, typhoid, or gastritis. So again, we know that rotavirus, it is more prevalent in under 5 children, and for the prevention of rotavirus diarrhea in the under 5 children, the government of India has started with rota vaccination. तो वो हम रोटा वैक्सीनेशन हम कब कब लगाते हैं कि जब बच्चा 6 वीक्स का है, 10 वीक्स का है, 14 वीक्स का है, तो 3 doses will be given, in which 5 drops orally it is given to the child. Now cholera again, it is a bacterial infection that is caused by Vibrio cholera. And typhoid is again, it is a bacterial disease that is caused by Salmonella typhi. And cholera and typhoid both are, the mode of transmission is fecal-oral route, and it is caused due to intake of contaminated water or contaminated food. So for this question, the right answer is typhoid. So in case of the person is having typhoid, so in that case the person is having diarrhea, that will be pea soup like. Now the next is sick cell test is performed to ascertain the susceptibility to which disease. So the options are tetanus, diphtheria, mumps, or syphilis. So what is sick test? So sick test is basically done in case of diphtheria, and diphtheria, it is again a bacterial infection that is caused by Corynebacterium diphtheriae. So what is done in sick test? So in this the test, it is a very simple procedure जिसमें कि क्या करते हैं 0.1 ml dilutant लेते हैं, किसका डिप्थीरिया टॉक्सिन का, और उसको हम पेशेंट की फोर आर्म में, वन ऑफ द आर्म हम इंजेक्ट करते हैं इंट्राडर्मली. आईडी वी विल गिव 0.1 ml ऑफ डिप्थीरिया टॉक्सिन. एंड पेशेंट की सेकेंड another forearm में what we will do, we will give heat inactivated toxin on the other side, जिसको कि हम क्या बोलेंगे, कंट्रोल आर्म. एंड इफ अगर पर्सन की बॉडी में इनफ एंटीबॉडीज हैं फाइट करने के लिए, सो there will be no swelling, there will be no redness on the injected site. And if the patient is susceptible to diphtheria, मतलब कि अगर patient susceptible है, रिस्क पे है कि उसको diphtheria हो सकता है, उसकी बॉडी में इनफ एंटीबॉडीज नहीं है, तो उस केस में जो हमारी टेस्ट वाली फोरआर्म है, उसमें क्या होगा, द पर्सन विल शो द सिम्टम्स ऑफ रेडनेस एंड स्वेलिंग. एंड अगर ये रेडनेस और स्वेलिंग मोर देन 5 to 10 mm diameter है, then we will call that the person is having positive test for sick test, and if it is less than 5, then it is negative for the diphtheria. Now the next is, which of the following anti-tubercular medication has the side effect of peripheral neuritis? So anti-tubercular medication basically we give for the treatment of tuberculosis, and all the anti-tubercular medications are hepatotoxic, and they can cause gastric upset. Mainly the patient will have having a symptom of anorexia, loss of appetite will be there. The person may have nausea, vomiting, or diarrhea. Along with that, they all are hepatotoxic. So in this case, which anti-tubercular medication cause peripheral neuritis? And the options are pyrazinamide, ethambutol, rifampicillin, and isoniazide. So the correct answer is isoniazide. Isoniazide is the anti-tubercular medication that can cause peripheral neuritis in the patient. तो उसको प्रिवेंट करने के लिए हम पेशेंट को साथ में पेरिडॉक्सिन देते हैं, that is known as vitamin B6. So due to vitamin B6, the patient will not have the symptom of will not have the side effect of peripheral neuritis. Whereas pyrazinamide cause hepatotoxicity in the patient. Ethambutol lead to optic neuritis. Rifampicillin lead to change of the body fluid. Orange color of urine can be there, or orange color of tears or saliva can be there. And apart from this anti-tubercular medication, there is also one main medication, that is streptomycin, that we give deep IM to the patient. And the main side effect of streptomycin is that the patient may have damage to the eighth cranial nerve. Hearing loss can be there. Vestibulocochlear nerve can get damaged. So all these five anti-tubercular medication, that is pyrazinamide, ethambutol, rifampicillin, isoniazide, and this streptomycin, they all are first line treatment for tuberculosis. Now the next is, rice water stool is clinical symptom of which condition? So the options are cholera, polio, food poisoning, or rotavirus diarrhea. So the correct answer is cholera. So already we have discussed the pea soup stool. The pea soup stool is a clinical symptom of typhoid, whereas rice water stool is a clinical symptom of cholera, and both are bacterial infection. Both are due to contaminated food and contaminated water, and mode of transmission of both the infections are fecal-oral route. Now the next question is, the drug of choice for chemoprophylaxis of cholera is, options are cotrimazole, tetracycline, amoxicillin, or chloramphenicol. So for this, the correct answer is tetracycline. So tetracycline is the drug of choice for cholera, which is given BD thrice a day. And in case if tetracycline is not available, then doxycycline can be given. And if we are talking about the chloramphenicol, so chloramphenicol is a drug that cause gray baby syndrome, mainly in the infants and premature children. Now the next question is, breakbone fever is the other name for which of the following? So the options are malarial fever, yellow fever, chikungunya fever, or dengue fever. So breakbone fever or hemorrhagic fever, both are the name that are given to dengue fever. So dengue fever is also known as breakbone fever. Now the next question is, in child with dengue, hemorrhagic fever, which is also known as breakbone fever, all the following should be given except. So what is the role of nurse in case if the child is having dengue, means which all steps she can perform except. So the options are rest and sleep, give ORS if there is persistent fever, prevent hypoglycemia, or give aspirin. So rest and sleep is very much important in dengue, and if the child is having persistent fever, ORS can be given to maintain the electrolyte imbalance. Hypoglycemia prevention is also one of the important nursing responsibility for the for the treatment of dengue. So which thing she should avoid? She should not give aspirin to the child. Now why aspirin should not be given? Because dengue is a condition in which thrombocytopenia is present. Means there will be the lower um, amount of platelet will get decreases. So aspirin should not be given because platelets are important for controlling the bleeding, and aspirin are antiplatelet. So if we give aspirin, again the platelet counts are already less, the child may have symptoms of internal bleeding. So aspirin should not be given in case of dengue. Now the next question is, the disease that is also known as hydrophobia is known as dengue, rabies, plague, or measles. Now what is hydrophobia? Hydro is related to water and phobia is related to fear. So fear from water. So this is which disease is known as? So rabies is known as hydrophobia disease. Now the next question is, leprosy is also called as Koch bacilli, Hansen's disease, Hendon's disease, or anthrax. So leprosy is also known as Hansen's disease. Again, it is a bacterial infection that is caused by Mycobacterium leprae, and it is a social stigma causing disease in India. And Koch bacilli is other name for tuberculosis, and which is caused by Mycobacterium tuberculosis. So this is all for today's video. If you like this video, so please like, share, and follow and subscribe our YouTube channel. एंड बाकी जो हमारी और क्वेश्चंस रह गए हैं कम्युनिकेबल डिजीजेस के, दैट वी विल डिस्कस इन आवर फर्दर वीडियोस. थैंक यू.